Well, welcome and thank you all for joining us for making the most of your Aquifer subscription. We really appreciate you taking the time to log on and join us today. My name is Megan Hotelling and I am the Community Engagement and Events Manager for Aquifer. On today's agenda, we will be covering a variety of things, including a content overview, assessment tools, information to get you started, and tips for creating the best student experience. We'll provide ample time at the end for a Q&A. We're on a platform you may be unfamiliar with. To give you the best experience possible, we encourage you to engage in the chat and to post your questions in the Q&A. To activate closed captioning from your computer, click on the up arrow next to the microphone and slide the toggle on. Or if you're logging in from your phone, click on the small keyboard button next to the emoji icons along the bottom of your screen. If you need to increase the size of your slides, you can do so on your own screen by hovering your mouse over the top right-hand corner of the slides and clicking on the plus sign. Joining us today include Dr. Emily Stewart, our Chief Curriculum Officer, Anthony Wilson, our Manager for Assessment Operations, and Leah Romano, one of our Relationship Managers. To start, Aquifer is a unique nonprofit organization dedicated to advancing health professions education through the use of high-impact virtual teaching and learning methods. Our Educators Consortium and our national partnerships lie at the heart of everything that Aquifer does. All of our content is conceived, created, and maintained by a small army of volunteer educators recruited through our collaboration with their National Educators Organization. Every case, every assessment item, and every teaching resource is developed and sustained in this manner. Dr. Emily Stewart, our Chief Curriculum Officer, is going to kick off today's presentation. Grab that presentation.
Thank you, Leah. My name is Emily Stewart, and I'm the Chief Curriculum Officer at Aquifer. I'm also an Associate Program Director for the Internal Medicine Residency Program at Dartmouth-Hitchcock Hospital and an adult hospitalist. Our holistic approach to teaching and learning focuses on ensuring health profession students are becoming successful clinicians. We provide clinically relevant learning tools in a manner that supports them where they are in their learning journey. We provide students with clear direction on knowledge gaps and strengths, then give them targeted learning opportunities through Aquifer content, followed by meaningful feedback and effective coaching, all supported by individualized data. We recognize that schools and students feel deeply the pressure of doing well on a standardized exam, and there are many wonderful programs out there to support that aim. But in order to be an excellent clinician, you need more, and you need tools that work together to leverage that understanding when they turn to their all-important test prep material as well. Unlike other e-learning products, Aquifer Cases walk learners comprehensively through each step of a patient encounter, from history, physical, and labs, through developing a differential, ordering additional studies, and forming a differential diagnosis, to treating and managing the patient. Throughout this process, core learning objectives are met through meticulously mapped teaching points, such that by the end of the course, all of the relevant national objectives have been covered. The cases provide in-depth, interactive, and engaging teaching along the way, much as you would expect from an expert preceptor, and ask the students questions to check and correct their knowledge before moving to the next step. Students routinely tell us that there is really nothing else comparable out there to prepare them for success on clinical rotations by providing them with the evidence-based clinical care knowledge that is needed to treat their patients. Aquifer cases are rich with real multimedia test results, modeled communication, embedded questions, deep dives, and links to references and more. They are peer-reviewed and continually updated by our expert medical educators on our consortium. Many educators think of our cases as a library of high-quality, standardized patients, easily accessible by all faculty and learners that can be used as you deem appropriate across your full curriculum. Programs often tell us students and faculty consider each Aquifer case a realistic substitute for a patient because they provide access to conditions and scenarios that may not be seen on a rotation due to your patient volume, seasonality, geography, or accessibility. We provide a safe space to practice clinical decision-making skills and access to patients in core conditions that students need to see. Aquifer has a library of over 200 cases, including our new neurology course, expanded clinical excellence case sets, and over 40 sciences integrated illness scripts. If your program is a curricular partner, like over half of our subscribers, you have access to our complete content library. Our curriculum covers the national curricula and supports a majority of core clinical rotations, all of which use the same clinical reasoning and pedagogical approach in order to promote consistent and effective cognitive practice within a supporting and safe learning environment. We partner with NYU and the Betty Ford Foundation to provide cases in surgery, readiness for residency, and substance use disorders. Our clinical excellence course has 50 cases on interdisciplinary topics that are historically hard to teach during fast-paced clinical rotations. To address this, we have case sets that focus exclusively on these topics, and we have embedded curricular threads that weave these key interdisciplinary teaching points directly into Aquifer's core cases. This provides just-in-time learning for our students and allows programs to ensure coverage that feels authentic without adding faculty time. With access to both the case sets and the curricular threads, programs have the tools needed for introducing topics for early learners, revisiting key principles during relevant core clerkships, and building advanced electives. Now let's talk about the integrated illness scripts. At Aquifer, we aim to bring down silos between basic science and clinical educators to create powerful tools for teaching and learning clinically relevant core basic sciences. In collaboration with IAMC, we have developed a comprehensive national curriculum and over 40 integrated illness scripts focused on the causal mechanisms of disease underlying common clinical conditions to support cognitive integration. The scripts are accompanied by a range of fully developed activities, easy to implement in the classroom or the clinic, to help your students make the needed connections, drive active learning and bedside teaching discussions, and most importantly, improve their clinical decisions. I will now turn it over to my colleague, Anthony Wilson, to discuss our assessment options.
Hi, I'm Anthony Wilson, the Manager of Assessment Operations at Aquifer. In recent years, there has been a shift in the assessment industry toward using assessment to drive learning, instead of merely measuring it. To that end, Aquifer offers several assessment tools. Aquifer on July 1st, 2023, launched our new formative assessment system, Calibrate. This innovative new assessment tool drives self-directed learning, identifying true knowledge gaps by calibrating knowledge and certainty, and uncovers curricular gaps for faculty. We offer Calibrate assessments for family medicine, internal medicine, pediatrics, and radiology, allopathic, and osteopathic schools, as well as nurse practitioner and PA programs. We currently are developing Calibrate assessments for neurology and geriatrics, and we have plans for sciences, women's health, clinical excellence, and other areas. Additionally, a clinical decision-making exam is available for internal medicine and is included with our internal medicine course subscription. The CDME provides the unique ability to assess your students' individual abilities, to apply their knowledge to make the decisions needed to provide quality patient care. The typical evaluations of student clinical decision-making by residents and attendings working with students in a clinical setting are important, but are limited due to the realities of clinical practice. The CDME helps to overcome some of these challenges and provides a way to enhance your understanding of students' skills. Let's take a closer look at Aquifer Calibrate. Calibrate is assessment for learning, as opposed to assessment of learning. Each exam contains 25 to 45 multiple choice questions. Each question includes a certainty rating to calibrate true knowledge gaps. Each question is also mapped to learning objectives and teaching points in Aquifer cases, which cover the national curriculum for STFM, CDIM, COMCEPT, and AER. Also important, Calibrate assessments are easy to administer and do not need to be proctored, easing the burden on programs. Calibrate is designed to be given twice during the clerkship, early and late, which provides checkpoints along the way. Early assessment will identify areas of strength and weaknesses at the start of the rotation, allowing the learner to plan, learn, reassess, and readjust their knowledge base. This is followed by a late assessment to evaluate areas of growth and ongoing weakness, helping to inform and prepare the student for lifelong learning, as well as the end of the clerkship exam. Calibrate reports are a powerful tool to drive self-directed learning for the student. The students get detailed reports that link directly to Aquifer learning objectives, teaching points, body systems, clinical foci, and cases. Faculty and programs receive high-level views of individual student performance and detailed views of cohort performance for curricular planning. Importantly, we don't include question and answer stems in the reports. Real patients don't come with tidy answers, nor do our reports. Rather, students are encouraged to dive into where their understanding is miscalibrated and develop an individualized learning plan, which is embedded in our system, for how they will address their learning gaps. Optionally, they can share reports with a faculty member or coach to inform a meaningful conversation during the clerkship. We also are developing a self-assessment question bank so that students can reassess their knowledge along their learning path. Clinical learning experiences are a valuable commodity. Calibrate empowers students to make the most of their experiences and direct their own learning. For faculty and administrators, Calibrate further supports accreditation standards for mid-clerkship feedback and formative assessment, and aligns faculty and students around a common assessment linked to curricular teaching tools, providing objective data to inform meaningful conversations, identify individual students in need of remediation, and identify curricular gaps for a cohort. In short, by developing Calibrate, we've addressed many challenges you all have by providing a high-quality, nationally developed formative assessment system designed for clinical learning. I'd now like to turn it over to my colleague, Leah Romano.
Hello, everyone. My name is Leah Romano, and I'm a relationship manager here at Aquifer. Today, I'm going to be showing you more about Aqueduct, our teaching and learning platform. Some key topics we're going to cover today are the searchable content library, custom courses, user management, reporting, and our Android and iOS apps. In Aqueduct, faculty and administrative users can look through the content library to familiarize themselves with content. And also, this is a great starting place for when you want to create a custom course. Aqueduct has a searchable content library, and you can access it by clicking the words Content Library in the header. This is available for faculty and administrative users, and it allows you to familiarize yourself with the content that you subscribe to, and then also search and filter by the keyword search or other drop-down menus to then take a look at the content or create your custom course. So we'll just dive in here as an example. I'm typing in diabetes in this example, and automatically the content library changes the results of what's available, and it highlights the number. So now I have 30 matches that I can take a look at. I might also want to use a drop-down menu and say, you know what, I want to focus on emergency medicine or other clinical disciplines to see which cases match those needs. And automatically the matches then change, and you can take a look at another set of cases. If you're interested in adding these cases to create a custom course, on the right-hand side, there's an add button, so you can save them for a custom course for later. I want to highlight that all of these filters and drop-down menus have corresponding color coding tabs in the results. So if you hover over them, you can see that in this example, the emergency department in green is a clinical location. Those in yellow are diagnoses, and a coral color is final diagnosis. And there are other examples that match the filters. Now we also have clinical excellence cases and curricular threads. And you may want to take a look at what those threads correspond to certain cases that are available. Now that I've clicked in this example, diagnostic excellence, we see that the threads appear in the middle of the screen. This one is pink with a star, and that highlights to you the result. You may also want to take a look at which of the cases also correspond with our basic sciences content. We have core concepts and basic science disciplines that you could type in or take a look at. I'll just X out on some of these other searches. Our basic science courses have a slight blue hue as a background, as a visual impact. And you can see that the basic science curricular thread is highlighted with a star in the middle of the tab. And then there are also corresponding purple body systems, and then basic science disciplines in teal to help you determine which you'd like to use. You could also at the top show any cases that have summary statements. So Xing out here. I'm going to click this little toggle button on the top left, and it changes the cases and it drops it down that you can see the current number right now is 89. And that corresponds with the cases that ask students within the case to complete a case summary statement. And you will see their responses in a report that we can show later. Additionally, on this page, faculty and administrators can click on the tabs on the right-hand side, such as synopsis and learning objectives, When you do, a pop-up window appears so you can read for more. There's also a button where you can click case summary, and a PDF is available for you to download that corresponds with the case. Now, if you're looking at basic sciences, there's an additional tab that you can take a look at. There's also a synopsis, but the mechanisms of disease map is also a pop-up. As I mentioned before, the content library is a great place for you to start to create a custom course. Whatever you select, and then on the right-hand side, there is a blue Add button. Once you click Add, and then the button at the top that says Create Custom Course, that's the start of the process of creating the custom course. And we have instructions in our dive in available to go over exactly what you need to do step by step. In Aqueduct, there are a variety of tools that can help you. For faculty and administrators, there's also a wonderful tool called Dive In, making the most of Aquifer. This is your self-directed learning hub. It's in green, and if you click on it, you can see that there are a variety of volumes that you can click for more. There's Aquifer 101 with all the how-tos on how to use Aqueduct. How do I add or remove a user? How do I look at a report? How do I create a custom course, and more? It's all listed there with videos and visuals to walk you through so that you have what you need. We also have Aquifer 102, Teaching Effectively with Aquifer. It goes into more detail of what the courses are, what's available. We also have a student experience and orientation that is available for the students, but it's a guide for you as well. It goes into detail about our assessment, as well as other features available. We recommend you take a look. Then lastly, in the dive in, is a chance for you to dive deeper and learn about Aquifer Calibrate, our formative assessment. It's got a great overview, key highlights, and then all the how-tos of how to use it. There's reporting, coaching, and more. We also have a team of experts here at Aquifer who can help. Another great tool that's available that's also connected to the dive in, on the bottom right-hand corner of every screen is the Need Help button with a question mark. If you were to click on it, there will be a keyword search, some preloaded and curated information based on your user role, as well as a direct link to create a support ticket. And these are great places to go when you're looking for more information. As you can see from the tour, we have a lot of key resources available for you, including the educator resources, the dive-in. Student learning resources are available. We have how-to articles, we have blogs, webinars, podcasts that can be accessed through our educator-to-educator resource directory, peer consultations, and more. They're all available as part of your subscription, and if you have questions, you can certainly reach out to our team. We're happy to help. Here are some ways to create the best student experience, and it's based on feedback from students as well as faculty. We hear from students that they get the best experience from Aquifer when cases are linked to other learning, either related to a patient in clinic, filling a gap in their experience, or as part of a group discussion or class learning activity. We also hear from faculty and preceptors that they're short on time and can't often recommend content to their students. So here are some suggestions. We have a patient library with a corresponding to-do list just for students. We also have self-assessment questions at the end of each case and detailed case summaries when the students finish their case. Now, more details are listed in your dive-in Making the Most of Aquifer tab, but we can go over some of the details here. The searchable patient library allows students the ability to direct their own learning. This is a simplified version of the content library that faculty already use, providing keyword search and filter options with drop-down menus to help find cases to prepare for clinic, brush up on key conditions, and fill gaps in knowledge and experience, just to familiarize oneself with the content, whether assigned or optional. When searching, students will not see the final diagnosis for each case. They can search by patient demographics, clinical location, body system, condition, discipline, and more. There is color coding to match the filters, recommended time, and other tools available to view on this page. They can also create a to-do list from their patient library to save cases to complete later and organize their work. We encourage you to keep this in mind when you're creating case assignments. For example, if your program assigns a lot of cases in bulk, you may want to consider assigning a smaller number of core cases and then allow the students to select the cases that fit their needs and interests. Pair this with Calibrate Formative Assessment to empower your students to direct their own learning using Aquifer's trusted content. Now let's highlight some best practices. Be intentional. Assign cases and incorporate them into your course and clerkship curricula. Select cases with learning goals in mind and consider a summary session to recap and emphasize your intended learning goals. Avoid assigning so many cases that students can't spend enough time with them, and link assigned cases to students' previous learning to ensure they've achieved the learning goals you intended. Know what you assign. Facilitators can make cases come to life when they know the ins and outs of the assigned cases, have a plan for guiding discussion, and can summarize the key learning points. Students value interaction around cases and appreciate facilitators who prompt discussions about what ifs and share their own personal experiences. Link the cases to clinicals. Direct students to the patient library to find specific cases to prep for a patient they will see or learn more about a condition that they encountered in clinic. Cases guide discussions. After students complete a case, discuss it as a group or ask them to bring their questions to clinic. Extend the learning by asking what-if questions to put a different twist on the scenario. For example, what if the patient had this symptom instead? Or what if the test results showed X instead? Plan how you will assign content, how you will assess students, and what progress testing you'll choose. Customize. Explore content that you subscribe to through the searchable content library. Now, this is going to be your best friend. It can familiarize you with the content, and it's a great place to start for creating custom courses. Students have let us know that when they understand the learning expectations and objectives, the Aquifer cases are more helpful to them. Students recommend reiterating that this is a safe-spaced learning environment. It's important to the students also know how to access and utilize the tools in Aqueduct. And finally, how to use Aquifer cases for independent study. Now, to help, Aquifer has created student orientation slides as well as short videos for students. Start with the slides. You can drop them in your course or clerkship orientation or custom course. Watch student videos. When students hear from their peers, they can get a better understanding of how Aquifer cases can help them advance their skills through complete, realistic clinical experiences. Also, share your goals and expectations in your course or clerkship. Orienting your students to your rationale for using the cases in your curriculum is very important. And finally, here are some great tips from fellow educators in regards to a didactic session. Assign Aquifer modules as pre-work. Use MCQs and SAQs as trigger questions to jumpstart didactic discussion. Consider interactive and skill-based activities during didactics. Seek student feedback when making changes to curriculum, and involve advanced trainees and junior faculty to fuel innovation and scholarship. We'd be happy to answer any questions you have or show you more. So up next, we'll now move on to the Q&A.
All right, excellent. Eileen, if you wouldn't mind coming on and joining me.
Hello.
Hi, how's it
Hi.
going?
Good. Thanks for inviting me on.
Everyone, this is Eileen Oshevsky. She's our Chief Engagement Officer at Aquifer, and she is joining me today for the Q&A. So if anyone has any questions, please feel free to put them in the Q&A or the chat as we get going. But Eileen, I want to start with something that we often get from people, or people want to hear our opinions. Can you tell us about what you're excited about with Aquifer and all that it offers?
Absolutely. Yeah. And I mean, in terms of Aquifer and all that it offers, I feel like it's a fairly unique solution. I think the cases, the in-depth level of the cases and how they take you from the initial presentation of the patient all the way through the follow-up and the diagnosis and the follow-up of the patient is fairly unique. And students tell us all the time that view of kind of the whole cycle of the patient is really robust and really important. And there's just so many great embedded tips, expert comments, tables, as well as media. Students talk a lot about, there's a video in one of the cases that presents labor and delivery. It's a film from labor and delivery. And they're like, so amazing to be able to watch that before I go and see like my first delivery. But in terms of what we're doing new, and what we've come out with new, I think there's some really great things. I'm personally really excited about that new student patient library. I feel like that Aquifer is unique in just the amount of depth of content that's in those cases. Many of our educators tell us like they don't have time to kind of go in. We built the content library to help with that. But the students, it was always a bit locked for them, right? The cases show up as FM12, 72-year-old man with chest pain, right? They don't necessarily know what's going on. They can take a guess. But that student patient library really puts the power in their hands, right? So now if I've missed a clinical experience, I'm feeling weak on a particular condition or body system or something, I can go in and find content for myself that'll make a difference. I can add it to that to-do list to do later. I think that's really, really powerful. So I'm really excited about that. I think the new Calibrate formative assessment that we rolled out this past year is really excited. I know there's a lot of formative assessment tools that people are kind of building on their own at schools, right? But there's not a great standardized formative assessment program that's easily available. And Calibrate is that. It's got really strong questions in it. It's aligned to the medical national curriculum. It's aligned to our cases, and it allows students to get a sense of where they're at early in the clerkship as well as later in the clerkship. But it also provides you as educators with a view into where students are. You don't actually see the students like detailed results, but you get a sense. You can look at your cohort where they're at, or you can look at an individual students and say they're at the novice level or they're actually doing just fine. They're at an advanced level. So I think that's really terrific. And we have some great new content this year, right? Neurology, first time we've ever had neurology cases, and that clinical excellence content. We've got it embedded in the cases as well as individual cases is, I think, really exciting for programs. So I know that's a lot, but there's a lot to be excited about. And I'm happy to go into detail on any of those if people have questions.
That's excellent. So I just popped the link to Calibrate from our page into the chat. And I'm also sharing the email address, exams@aquifer.org, if people are looking for some additional help to get started with Calibrate, or have a meeting with someone from Aquifer about it. Let's see. One of the questions we get asked a lot is, do you have women's health / OBGYN courses?
So a couple of answers to that one. Number one, we have a lot of content available now, which can be mapped to a women's health course. If you're a curricular partner, you've got access to cases across our whole library. So you've got the most content available. There's cases that are mapped to women's health within radiology, within family medicine, internal medicine, geriatrics, our clinical excellence cases, right? So there's a lot of great content. And for that, I encourage you to go into that content library and just search on women's health and see what's available with your subscription. Your subscription, again, if you're a curricular partner, you've got all of that. If you're at a school that's a limited subscriber, you probably have some of that. But to find that content. The truly exciting piece, though, is that we are developing a new OB/GYN course. So that course is going to be available in the 24-25 subscription year. We're working on it right now. Curricular partners will have, and again, that's programs subscribing to all the content. We'll be getting the content. The cases will be released throughout the year. So we'll have a set that's available on July 1st. I was hoping we could say 10 cases, but we're not. I can't commit to a number yet, but we'll have a set that's available on July 1st, and then more will be released during the year. The following year, that'll be available for sale to limited subscribers as well. But curricular partners, there's going to be some cases specifically designed for OB/GYN. So that's really exciting. I think that's a key area that we get asked about a lot. And, Aquifer brings and they're all peer developed. They'll be developed by specialists in the field. They're continually updated, and people are just anxious to have that kind of model in women's health OB/GYN.
Absolutely. That's excellent. I'm not seeing any questions in here. So should we take a minute or two to go through the checklist on getting people started? Does that sound good?
Yeah,
So
sure thing.
I'm going to pop them into the chat, and then I'm going to highlight them so that you can talk a little bit about each of them. So first
Okay.
one,
Terrific. So yeah, so Leah went through kind of a lot of different pieces, right? To, how to get started. And I saw somebody was asking about getting the slides, and you will have the recording and the slides later, Megan.
Yeah.
Yeah. So you'll be able to go through that, which is great. It goes through details, but just at a high level, when you're using Aquifer, make sure you've got a plan, right? Like, why am I using it? Why am I signing it? And that plan is communicated, right? So it's not just like, oh, this is an optional resource that's available. That's nice, but your students are very busy, right? So what am I going to do? And as Leah suggested, your plan might be, I'm going to sign 5 to 10 cases, and I'm going to have students, use the student patient library to find things to fill in for mixed experiences. Some people choose to assign everything within a course. Some people build a custom course. We'll talk about that ahead of time, but make a plan for what you want to do with content, I would say, is number one.
Absolutely. All right, here's the next one.
Yeah, make a plan for assessing your students, right? So the students will say, great, I got assigned these, but are they just, busy work, nice to have? Is this integrated into the curriculum? So assessing can come in a couple of different ways, right? Assessing could be they're going to have to create a self-reflection, right, that they turn in. Assessing could be that you're going to be looking at their summary statements within the case to make sure they completed. Assessing at some programs is actually just looking at the course report and seeing if they completed. We have the Calibrate formative assessments now. That's a formative assessment tool. That's another form, right? You can assign it early in the curriculum. Students can see where they are. They can make their own learning plan if they want for completing cases or complete what you assign. And then they can see where they are at the end, and you can see their progress throughout, right? Okay, great. You progressed and you are now at an advanced level. I forget what the top level is. It used to be master, but it's not. I think it's competent, right? You're at the top level. So whatever your form of assessment is, and one other one I'll throw out that not everybody's got the ability to do this, but we've heard students say, I had to actually present on a case in front of my peers, right? And boy, did I learn that condition more than anything else, right? Nothing about having to do that. So whatever it is that you're going to do, make sure, or even if you're talking about them, if you have a course section and asking students to have a discussion, that they're integrated into your curriculum and you have a way to kind of reflect back on the content and assess their progress.
Excellent. All right, here's our next one.
Yeah.
Yep.
Yeah. So that searchable content library that Leah was showing is just, it's super, right? Some people buy the subscription. They say, okay, I can only use it in my family medicine course or my pediatrics course or whatever. There's actually just a whole bunch of hidden gold in there. And the content library is a way to explore it. So you may find content that you say, this really fits in my didactic or my preclinical curriculum. This content might fit really well for some kind of a transition to residency or transition to practice course. We've already talked about women's health where we don't have a course right now, or emergency medicine. So there's a lot of content that can be used across all the learners. Your subscription gives you access for all the learners at your program, all the faculty at your program. So use that library and make the most of that subscription. I think it will help your learners to have kind of a consistent learning tool that's used throughout. It also helps faculty, right? Because it's like you don't have to go looking for stuff. It reduces a lot of static and time. You've got this amazing pot of gold.
Excellent. I like that. We do have a pot of gold.
We do.
We have another pot of gold with this.
The custom courses. So custom courses are terrific, right? Some people will just say, all right, family medicine, and they'll put in their syllabus, maybe do these X number of cases. If you take the time to set up a custom course, right? It could be the entire family medicine course. It could be a subset of them. Or you could say, I want to have those, and I want to have a diagnostic excellence case in there. And you know what? I really want to have this additional geriatrics case on falls in there, right? So you can, or an integrated illness script. So you can pull in the pieces that you want, be it the course as it is or the, a combined version of the course, and create a custom assignment. So you can put, and it's super easy to do, right? You can just cut and paste. These are students in this block or course. And then you can put in notes. This is what I want you to do. I want you to have these completed by this date. I want you to, pick 5 of your own that you're going to do, whatever it is. You can type out that custom assignment, and then students will get an email with that information. It'll show up when they go to that searchable patient library. They'll actually have a page on my assignments. Cases will show up on their assignments, so they'll see them there. You'll be able to get a custom report if you want to track usage with just those cases and just those students. So it's got just a lot of benefits, and it's really easy to do.
That's awesome. Here's another important one.
Yeah, Leah talked about this, right? But that in orientation, we hear a lot from students, once I got into the cases, it was great, but at first I didn't know. I didn't know why they were being assigned. I didn't know what they were all about. It took a little while. So we've got some nice slides available. We've got a nice video available. Just take some time with your students to let them know what's in there, why they've got them available. Don't forget you've got that patient search library. I think it goes a long way.
Absolutely. And then the last one. Track and check in.
Yeah. So just track how they're doing, whether you're looking at those course reports or however it is you're tracking, and check in with them. How's it going? How's it going with your Aquifer cases? Are they helpful? A reminder, you missed that experience in clinic. You didn't get to see, it was summer, you didn't get to see a case of pneumonia. Reminder, you can go in and do these cases. Talk to them. Are you doing an individualized learning plan if you're taking Calibrate? Are they helpful? I think that's it's a great resource for the student, and it's a great way for you to get feedback on them, but also to help them really advance their learning. We're a not-for-profit. We do obviously have subscription base that pays for being able to maintain and innovate and continue to come out with new content. But really, we're mission driven, and we're all about improving the student learning experience. And we hope, and I know that's what you're about as well. So if there's anything else we can ever do to help you, please be sure and share that information with us.
Absolutely. Absolutely. All right. I don't see any questions from anybody who's attending. So
should we do a count to 10 and just wait and see if anyone wants to put a question in?
last chances to ask any questions. All right.
All right. Well, I can say thank you all very much for subscribing to Aquifer. We really appreciate it. We appreciate your dedication. Oh, thank you, Cindy, for that kind note. We appreciate your dedication to your students. We appreciate your dedication to your patients if you're a clinical caregiver. And we hope that Aquifer helps you provide a better experience. So thank you so much. If there's anything we can do, please reach out and let us know.
Absolutely. Thank you all. Have a great afternoon.